Hey, what's up, everybody? Video 44 coming at you in another video. All right, so feel pretty good. Left therapy, did good. I decided not to do the video as I was leaving therapy because my battery was at a weird spot. I forgot to charge it while I was there, so I know how quickly this battery can drain. I figured I'd want it more so now, but it was a good therapy session. Unfortunately, I was able to get there on time, but it was a weird situation where the receptionist wasn't at the desk when I got there. And when she finally did get to the desk, she immediately had to answer a phone call with a very ornery person. And I saw how much of a help she was having with that person. And then people started coming in while she was on the phone and, you know, more or less stepping in front of me, getting addressed. I thought Lydia may poke out the door to see if her 1 o'clock had arrived, but she never did. So Lydia actually didn't see me until about 1:30. And I finally told the lady, hey man, I'm waiting on Lydia. I've been here for 30 minutes. She never addressed me. I'm like, I thought she was sharp in terms of, not Lydia, but the receptionist. I thought the lady was sharp as to say, I know he was here before I got back. There was no one there to relieve me. So let me address him at some point. I was keeping eyes on her as she was talking to that person, and she was rolling her eyes at me like, this person's driving me crazy. I figured she would get to me at some point, since it was literally nobody else whose job it was to do so for whatever reason. She didn't have any relief at lunch. So it was like, I don't know, that whole situation. Lydia asked me if I wanted to more or less snitch on the lady. And I was like, not really. So I've actually been in her situation. It just seemed to me that you guys didn't have relief for her. But I think Lydia kind of wanted me to do so. I think Lydia was actually more frustrated with it than I was. You know, she's like, we have a processing issue here. In other words, that receptionist situation has probably been a reoccurring problem for them, right? So I don't know if it's a her problem or if it's the fact that they don't have relief for her or somebody's on vacation or whatever the case may be. The person that's normally there doesn't usually have that problem. She gonna make sure she scanned the whole lobby, make sure everybody is checked in. She gonna ask you if she don't talk to you for 5 minutes and you don't see from her. If you don't address her, she will address you. So it's like, I don't know. I don't know if what happened there. I don't want to presume that the lady went on lunch without actually having proper relief, and maybe that relief just wasn't there for her. But whatever the case may be, I tried to give her the benefit of the doubt to get to me, and she never did. That's what it really came down to. And it started eating away at the time I was supposed to be talking to Lydia. But good thing was, Lydia's 2 o'clock was late. So I was able to actually get about a good 50 minutes in anyway. So it all worked out. I did not snitch. I didn't tell on the lady. But I think Lydia was kind of hoping I would file a complaint. Get that receptionist in a little bit of trouble. But I don't know. That's not the vibe I was feeling today. I don't want to do that. Anyway. So, yeah, man, that's how that went. It was a good session. I got a take-home thing to do, which is something I've never done. Every time she gives me some assignment, I'll never do it. But in this case, I see the fruit in doing it. It can really help with the data. Essentially, she wants me to compare how I felt when I was out of control, not within control of keeping myself comfortable, versus how I feel right now when I have a lot more control. So we're essentially taking me back to when I was 2 years old and how I had no control over getting out of the traumatic circumstance versus now when I'm choosing to stay away from stressful circumstances. What are the differences I see in myself as I assess both sides, both versions of self? So I'm looking forward to that exercise. And, you know, she talked about relationship stuff. She wanted to know how I assessed. She wanted to know if I was a part of an IP program, which was like I think it's IP. I think it's what she called it. I'd never heard of it, but it's been a program in California since 1975 that's usually pointed toward people who have developmental issues in school. They give you a special curriculum for yourself. I did not have that. And then she wanted to know about my relationship history. And she said that as she had been trying to assess my specific situation, she was taking those two things and trying to see if there was any correlation between her theory that I might be slightly autistic. But she said she has absolutely no data for that theory right now. But she said some of the behaviors, it could potentially fit in that category. So I'm like, I doubt it. I don't really have sensory issues, to be honest with you. My understanding of autism is people usually have sensory issues, loud noises and stuff like that. You know, depending on how the level of autism, they can't really handle that type of thing very well. But what I will say is there's a person I follow online who is a high-functioning autistic person who has a lot of the same traits that I do, but I never felt that I was slightly or even remotely autistic, to be honest with you. I don't think so. But she's trying to figure it out, you know? She's trying to figure it out. And I told her, I was like, you know, to be honest with you, I've never been obsessed by anyone other than you. And I've always thought my whole life that what I had was whatever was wrong with me was rare. I never seen it in anybody else. I never heard of it anywhere. It's the type of traits that I have that all come together to make up my mental assessment itself. I ain't never seen it before. So I don't know that this isn't something that you would have to actually be discovering for the very first time. Like, I don't know if you can look at other people's brains and say, okay, he has this. I actually think you won't, to be honest. And that's what I told her. I was like, I don't think so. I don't believe myself to be autistic. I do not believe myself to have ADD or ADHD or whatever high definition television program. I don't have none of those things. I don't believe, but there's something there. It is very deficient, and we got to get to the bottom of it. And I wish I would have been studied sooner so that we could have a diagnosis. Maybe there is no diagnosis. But what I can say is I've struggled. And she was asking me, like, in terms of progressing over the time, how do I feel about my trajectory from when I was having some of my strongest issues to when I've done well with handling some of what it is I've struggled with. And I told her more or less that there's no real upwards progression. It's just extremely volatile. Either I'm doing really well in this particular area or I'm doing terrible. Really well as it pertains to having a job, being there for several years, in the routine, performing well at the job, which I've had several peaks of doing, and in deep isolation where I refuse to even leave the house, which is really, really bad. And I've had both a lot, a lot of times throughout the course of my 40 years of living. I've seen highs and lows like that on and off my whole life. So she says, what triggers those? What doesn't? I'm like, you know, you tell me. That's what I'm here to try to figure out, more or less. I think it would probably be necessity in certain cases as I look back on it. I needed to get a job so that I could have what I wanted. I needed to, you know, it was usually necessity. But as of late, I felt like I've just been exhausted as it pertains to addressing work, and I don't feel like I have anything to give it. I feel mentally exhausted, spiritually exhausted as it pertains to working a 9-to-5 and adhering to whatever task would be given to me for $12 an hour. I just don't think I have anything to give it. Even if I were to get a job today, I think the way I feel, I would probably just not perform. Even if it were necessary that I do, I would do the absolute bare minimum. I really don't care to do it anymore. And, you know, she said, why is it so important that you be comfortable? And that's what led her to coming up with the exercise that she wants to give me. So it's like, okay, I mean, I'm definitely feeling what she's doing, but I anticipated this being what it is. I did not think that it would be easy for her to assess me or kind of compare my mind to some of the other people that she sees. I don't particularly think I don't think too many psychologists have met anyone like me, to be honest. But it is what it is, man. It's got to allow them to do their job and throw things out there and see if it sticks. But as far as us being close to some type of diagnosis or conclusion of what it is I'm dealing with, I think there's still so much for her to learn about my specific traits that would give her the data she's looking for. There are things that she doesn't yet know that are very prevalent as it pertains to understanding me. And she has she was within her studies and her training, she believes that it's not necessary to pinpoint what causes certain things in order to redirect the behavior. But I think what she's running into is what I thought she would run into, which is if we don't pinpoint what causes the behavior, you're not going to actually be able to know how to treat me. That's how this brain actually works, because there were key things that happened in my life that triggered the way I process and the way I choose. And so if we don't get to the bottom of those incidences and devise some type of understanding of what all of the different behavior patterns are, then you're only going to be assessing a fourth of what it is that you're actually supposed to be really understanding about myself. I told her, I'm layered. I'm very intelligent. I'm layered. And I went through traumas and I assessed them a certain way and behave a certain way because of it. And some of the stuff that I think is so very relevant are things that we haven't even explored. So it's like, you still don't know everything you need to know yet. But I think we're getting there. We're getting there. I just think she's coming to the conclusion that this is not going to be an easy patient to treat nor diagnose at all. And I've always told you guys that. That's why I started this channel. Because I've been extremely self-aware. I definitely know I need to get better at things. I definitely know it's not the end-all, be-all to my life is comfort. Because I've stayed in spaces where I was comfortable for a very long time, and then things went terribly wrong. And so now I don't like the consequences when things go terribly wrong, but it doesn't necessarily mean I can't find myself comfortable in the spaces that lead up to things being terribly wrong. So we need to get to the bottom of all of that so that we can actually know what the hell you're dealing with, basically. So that's kind of what today was about. I'm glad we were able to spend more than 30 minutes communicating, because she really is starting to get to a space where she's throwing darts at the wall, trying to figure out if it's sticking as it pertains to what she thinks that she sees here. But like I said, there's more for her to know about the behavior, about the trauma, and all of that. And so that's just what it is, man. I really like I really like Lydia. I think she's learning through things. I think she's, it's one thing to go to school and learn about psychology. It's another thing to get unique minds in your room and discussing things that maybe weren't in the books, or seeing certain behaviors that maybe haven't been studied as much, or maybe it doesn't align with what it is you were taught. I think I'm probably one of them cases, and I figured I would be. So I don't know, man. She's trying to figure it out, and I think she's doing a good job. But I think by the time she's done with me, she'll have an entirely different set of things to assess patients with, because I don't think I'm like any of these other patients that she's dealt with. So that's pretty much what it is, man. I wanted to give y'all an assessment of where we're at with my therapy. I don't imagine that we're close to fixing the problem, but at least we have some things that we're working on, and I like where we're at. I'm very comfortable, so that's the good thing. So that's pretty much what I got to say. My name is BDO44. Thank y'all for watching.